Are you a doctor looking to move away from direct patient care and currently considering alternative career options? If so, this video is for you because we will be taking a deeper dive into what options are available. There is a logical way to think about your options, which I introduced in my previous video, which if you haven't seen before, I would really encourage you to watch it after this video. Before we take a deeper dive into each section that I outlined in the previous video, I would like you to think about whether it's clinical practice itself or whether it's something else, for example, a setting that is driving you away from direct patient care. What do I mean by a setting? A setting could be your overall healthcare system, or it could be a particular country where you're currently based and practicing as a doctor, or it could be a hospital or general practice in the community. So it might be a factor that is important for you why you're not currently happy. There are, of course, many other factors that will be important for some of you and maybe less important for others. For example, the people. Let's say you no longer want to be dealing with people who are sick. Or it could be the rewards. This is not always just financial rewards. There could be many other rewards that you may not be happy with. Or it could be the skills that you are using but you don't like to be using them. Or it could be the skills that you would like to be using but you're not getting an opportunity to do that in your current work. So there are many factors that will be important, and I would encourage you, before you consider your specific options, to actually take a step back and go through that self-discovery to understand better which particular factors are driving your decision to move away from patient care. To help you with this, you can download a special exercise which I designed for doctors like you, which you can get via the link below in the description. When you have completed the exercise, you will see much clearer which particular factors are playing a big role in your decision to leave medicine or leave direct patient care. Okay, so the first section that you saw on the diagram in the previous video is where you would be relying heavily on your medical degree and your medical background. Perhaps it would be a different setting to where you're currently working. So here we would be thinking about becoming a ship doctor or crowd doctor, or doing sports medicine and being based within a football club. You could also think about options like repatriation of patients from other countries into their home country. And here you would also think about telemedicine, so doing digital online consultations, if you're not doing those already in the current COVID situation. You would also think about cosmetic medicine and think about expedition medicine and other settings like prison medicine and space medicine. You would also perhaps think about doing research alongside clinical practice. The second section on the diagram is where you're still using your medical degree and heavily relying on your medical background, but you're now looking a bit more broadly beyond patient care in a traditional sense. So, for example, you could be a functional assessor for people who are claiming for their disabilities, or you could be doing medical legal work. For example, for experienced consultants and GPs amongst you, you could choose to become an expert witness. For less experienced clinicians amongst you, you could think about moving into supporting roles for doctors who are undergoing investigations by the regulatory bodies. Public health and global health are big topics that I will cover in a separate video, possibly several videos, because there are so many roles in these areas that a physician could fit into. Medical education. There are some roles where it is really important that you continue practicing as a clinician. For example, if you would like to teach medical students. But there are other roles where it is less critical to continue practicing as a clinician. And again, I will make a separate video about medical education in the future. Medical research is also another option where you would be utilizing your medical degree and medical background, and this could be based either at a hospital, in which case it would be called a clinical research site, or could be based within a pharmaceutical company or a biotechnology organization or a contract research organization. Again, I will cover this in a separate video where I will talk about a particular role called a clinical research physician in greater detail. In the middle of the diagram that we previously saw, there are roles where you may or may not require your medical degree, and most likely you will still be using your healthcare background. And here we would be thinking about some roles within the pharmaceutical industry, as well as medical diagnostics, medical technology. Healthcare policy and healthcare regulation would fall in this category, and examples would be for the UK, roles within the regulators of the medical profession, such as the GMC or CQC, the regulator of clinical providers. Drug and device regulators, such as the MHRA or FDA in the US or EMA in Europe. You would also be looking into options in medical writing. There is a difference between medical writing for pharmaceutical organizations or healthcare organizations compared to medical journalism, and I will create a video in the future covering this topic. You would also consider healthcare-based FMCGs, so fast-moving consumer goods companies, for example, Procter & Gamble. And here you would also be thinking about education in a broader sense. You would also think about working as an advisor for think tanks, for example, the King's Fund. And of course, medcoms, medical communications, which is a very broad topic, which I will cover in a separate video. As we move towards the right-hand side of the diagram that we are going through at the moment, we are now moving into the area where your medical degree is not really required, although you may still be benefiting from your healthcare background. For example, management consultancies, strategy consultancies such as BCG or McKinsey often recruit medical doctors into their healthcare groups. Here you would also be looking into hospital administration, so leadership and management roles, where your healthcare background would of course be very beneficial, but your medical degree as such is not required. Also, there is a very exciting role of a clinical UX designer. You can learn more about it from a separate video of my interview with Dr. Melissa Siunisen, a GP who transitioned into the field of human-centered design. Of course, bioequity research is another option that you could consider here, and not forgetting life coaching or career coaching. Finally, to the far right of the diagram, we have all the other options. Here, instead of your medical background or a medical degree, you would be using your transferable skills and any other technical skills that you already have or you will have learned by the time you transition into that role or industry or career. We are talking about anything and everything, such as teaching, marketing, accountancy, finance, journalism, and of course medcoms, medical communications, which is a very broad topic which I will cover in a separate video. As we have moved through this diagram, you will have seen that there are so many options out there available to you, but you do need to decide whether it's important for you to make a clean break from medicine or whether you actually want to continue utilizing your medical degree to some extent. You don't need to make this decision right away, but it's something certainly to think about. And again, I would really encourage you to take a step back and go through this self-discovery process and use the exercise worksheet, which you can download from the link in the description below. I would be really interested what particular option you're currently considering or thinking about, and I would be very happy to prioritize that particular topic for my next video. Please let me know in the comments box below. If you like this video, please give it a thumbs up and subscribe to my channel. And I look forward to sharing more insights about all those amazing careers and opportunities out there beyond the clinical bubble with you in the next videos to come. Until then, bye bye.